Hi, everyone. Welcome to today's seminar. I am Rachel Werner. I am the Executive Director of the Leonard Davis Institute of Health Economics here at the University of Pennsylvania. Today's seminar is on food policy opportunities to build a healthier America. So food policy has been getting a lot of attention recently. The federal government is showing renewed interest in the connection between the food Americans eat and their health. Robert F. Kennedy Jr., the Secretary of Health and Human Services, is pursuing his agenda to make America healthy again, identifying the food that Americans eat as a major driver of their health. And RFK Jr.'s ideas for food initiatives have proven to be among his most popular with the public. At the same time, state and local leaders are continuing to pursue policies that influence the food that Americans are eating. But improving health through food policy is far from simple. There are many ways in which policy can shape what people consume, including nutrition assistance through programs like SNAP, tax policies affecting food pricing and access, regulations targeting nutritional quality and marketing of food products. Adding to the complication, food and nutrition policies are developed and implemented at multiple levels of government and influenced by a diverse set of actors, including federal agencies like Health and Human Services, industry stakeholders, public health advocates, and consumers themselves. So to make sense of this evolving landscape and policy and to help us better understand what is possible, I'm excited to be joined today by three national experts on food policy. First is Aviva Musicus, who is the science director of the Center for Science in Public Interest, where she manages their campaigns on food labeling, food additives, sodium and added sugar reduction, new technologies, and health policy. We're also joined by Christina Roberto, who is the Mitchell J. Blutt and Margot Crody Blutt Presidential Professor of Health Policy here at University of Pennsylvania. Her research aims to identify and understand factors that promote unhealthy eating behaviors and design interventions to improve eating habits. And we are also joined by Lynn Silver, who is a senior advisor and director of the Prevention Policy Group at the Public Health Institute, where her current work includes research, advocacy, and technical assistance on food policy, and strategies to increase the funding base for prevention and health equity. Thank you all so much for joining us today. I'm looking forward to this conversation. Aviva, I wanted to start with you and ask if you could start us out by telling us about the latest from the Trump administration, which is the MAHA Children's Strategy, or the Make America Healthy Again Children's Strategy, which was issued just last month in September. And as I understand it, the report includes some ideas that policy experts support. Can you talk us through the range of things that are included in that strategy and highlight some that you think are most important given the evidence?
Yeah, I'm happy to, and thanks so much for having me. So the MAHA Strategy Report is a set of recommendations from the MAHA Commission, which is a group of leaders of executive agencies across the government. So the head of the USDA and the head of HHS are on there. And the recommendations are telling the federal government what they should do to end childhood chronic disease in the United States. Now, before I get to the content of the report, I think it's important to note the broader context here, which is that we're generally seeing a disconnect between what the federal government says and what they actually do. So this administration has said that we need to address chronic disease, we need to fix our broken food system, we need to make America healthy. But what we're seeing them do in real time, like right now, is dismantling public health infrastructure, firing tens of thousands of federal workers who are in charge of keeping us safe and healthy. We also saw Congress defund SNAP and Medicaid. And all of these actions are poised to make America sicker and hungrier. So that's the backdrop against which we're talking about the government's list of strategies to end childhood chronic disease. So there's a lot of cognitive dissonance here, and I just want to acknowledge that up front, that we're just going to have to hold that. A lot of the recommendations in the MAHA strategy report are largely not about policy. They're focused on things like deregulation, voluntary industry action, education, and calls for more research. Just to highlight a few of these, recommendations for deregulation were largely related to the agricultural industry, including around pesticides. That got a lot of press attention because MAHA has been very critical of pesticides up until now, and the strategy report was pretty permissive towards the use of pesticides. There were also a lot of recommendations in the strategy report around education, including multiple recommendations related to the need for education around healthy eating and exercise. So, all of this is a big win for the food industry and especially the agricultural industry. And it highlights this contradiction between Maha leadership's fiery rhetoric about the need to hold the food industry accountable for poisoning us, which they often say, versus the reality that Maha is part of a broader administration that actively wants to deregulate. And I think that deregulatory desire really won out here in this report. However, the report did make some recommendations related to policy and some that we are excited about that are potentially positive. So I want to share a few of those with you. A big thing we're hopeful for from this report is food chemical safety reform. This is needed because currently food companies can secretly add any ingredient they want into our food supply without telling the government that they're doing it and without testing it for safety. This is known as the generally recognized as safe or GRAS loophole. This report recommends that the federal government pursue GRAS reform to fix this loophole. They want to close the loophole. The report also recommends fixing the way that we reassess the safety of chemicals that are already in our food supply. It is a huge deal that they're saying that they want our food supply to be safe and that they're recommending regulations to do it, not voluntary action. So that's really important to focus on is that this is one area in which they're saying we don't want voluntary, we want regulations. Other things that we're hopeful for, the report said that the dietary guidelines for Americans should align with science and should prioritize whole foods and limit processed foods and added sugar. That sounds good. It also recommended promoting healthy foods in USDA nutrition programs and increasing funding for Head Start programs, which are for early child care. This also sounds good. There were also recommendations around front of package nutrition labeling and defining ultra processed foods as kind of the start towards thinking about policies that could regulate ultra processed foods. All of this sounds really good, but as I mentioned before, what they say is not always what they do. So we're going to need to hold the administration accountable to actually following through with these recommendations that we want to see happen.
Great. So you went through a lot, and we're going to get to the things that are missing and many of the problems that we're facing. I want to focus a little bit on um, uh, some of the positive pieces which you talked about, and maybe ask this question about, are there other pieces you were really expecting to see in there that you didn't see in there, or what was missing from the report?
I mean, things that were missing that I was surprised were missing because they are so important for childhood chronic disease and preventing childhood chronic disease. The report doesn't mention sodium and it mentions added sugar only once. The report is also missing policy action to address alcohol and tobacco use, which we know are responsible for a lot of chronic disease in this country, and use often starts in adolescence. Um, Also, kind of notably but unsurprisingly absent from the report were any strategies to address health inequities or social determinants of health, which we know matter a lot for health. So ideally, we would have some strategies to try to tackle those.
Yeah. Okay. And then Lynn and Christine, I want to invite you to weigh in also with your thoughts about the report.
Go ahead, Christina.
Sure, happy to jump in. So I don't disagree with Aviva in terms of a lot of bad stuff has happened to public health and is undermining public health and cuts to programs. But I just want to contrast, like so in the Biden administration, they put together this conference on health, hunger, and nutrition. And they were like, we haven't had a conference like this in 50 years. And they wrote a big report about it. And when I read that report, I was just crestfallen. I was like, man, I can't believe that no one is pushing the envelope, that we're not moving this conversation forward. They then put out a report that was kind of like, talking about the future of nutrition in the country. My colleague and I, who I work closely with, we read that one and we are like, man, how is this the vision? So when I picked up the Maha report, with all the caveats in the world, it's not even like I think any of this stuff is going to happen, but just the narrative and the language and the list of things they want to do, I have to admit that I thought it was solid. I'm like, I would make this list. If you asked me to do this, I would make this list. And like a big change that we almost never see is this conversation around like we can't minimize like if you truly could get government programs, get school lunches to have minimally processed foods and remove ultra processed foods from them. If you could do that, I'm not saying they're going to, but if you could, that'd be incredible. And so, yes, I have plenty of criticisms, but in terms of just setting the stage and painting a vision here, I buy into a lot of that vision. Not on vaccines, but on this.
So you fair to say you see this as an opportunity. RFK Jr.'s vision around food policy as an opportunity.
I do.
Lynn?
I would largely agree with everything Aviva and Christina said. I think in terms of discourse, the report represents a quantum leap in acknowledging the problem of our nation's food supply and the impact that's having on not only children, but adults. So that is great. But it is that divorce between the discourse and the scope of the proposals to effectively address the problem that is clearly identified. That's still a problem. And there are some good proposals in there. It doesn't take on some of the elephants in the room, like the fact of massive subsidies to big agriculture as opposed to creating economic incentives and levers that would really support our farmers and agriculture to produce the kinds of foods that we need and make them financially accessible. But it does have some positive things in areas like grass, generally recognized as safe, like food as medicine, um, and other areas. But it also, as was mentioned, fails to address other threats to children's health. And in addition to tobacco and alcohol, I'd add cannabis, which is now more widely used than tobacco. Um, and it has some correct observations about overuse of medications in children. The huge threat, though, that we can't not acknowledge, a pediatrician, is the vaccine issues, which are truly dangerous. I started my career in 1979 in the middle of a measles epidemic, and I saw 1,000 kids die from measles. People don't remember that. 6,000 people used to die from measles a year in the United States 100 years ago. That we are undermining confidence in breathtakingly effective vaccines is terrifying. And then I think Aviva mentioned, we just have to remember that the things that really profoundly affect child health, being a wanted baby, your parents having jobs, health insurance access, access to childcare, being safe from your parents being dragged away in the street, are also deep, these are things that have deep-seated and lifelong effects on the health of our children. So some really promising, great discourse, some good ideas, but also some big holes and some dangers.
Yeah. So I wanted to turn to one of those holes or one of you set up the backdrop against which this is all happening. And that is that with HR1 or the One Big Beautiful Bill Act, the Trump administration has made unprecedented changes to the SNAP program. And so, Christina, I'm going to ask this to you. Maybe just tell us a little bit about what SNAP is and what the changes under HR1 have been.
Yeah, sure. And I just want to applaud Lynn because I think she very beautifully articulated just the the whole picture. I always feel like I need that disclaimer. Like if I could stabilize and save vaccines, I would do that instead of improve the food system. Okay, so let's talk about SNAP. SNAP, it's our largest federal program designed to address food insecurity. What is food insecurity? It's not having sufficient access, stable, right? Stable access to sufficient amounts of food. Okay, you should have an intuition right now that food insecurity is a bad thing, but research has demonstrated it's a bad thing, right? So it's linked to increased hospitalizations. It's linked to, type 2 diabetes, anemia, thinking, memory problems, like all sorts of issues. Low birth weight, which portends all kinds of problems. So we know it's bad. And SNAP is very effective at addressing it. And what's really interesting is we actually have pretty incredible data because when they rolled out SNAP in the 60s and 70s, there was this staggered rollout that allowed researchers to then look at what happens to kids in a household receiving SNAP over the long term. And when you look at that, you realize, oh my God, it's an extremely cost-effective program because basically every $1 that's invested in SNAP yields $60 worth of benefits. So when you track these kids have longer life expectancies. They're more likely to have economic self-sufficiency in adulthood. They have lower incarceration. They have lower obesity, type 2 diabetes. So it's just very clear that this program has this tremendous health benefit and societal benefits. Okay, so what's the big change with HR 1? The federal government, and just to give you some numbers, so last year it was 42 million people are receiving SNAP. The federal government spends about 100 billion each year on it. That, waffles depending on the year. The federal government has always paid the SNAP benefits, the money people receive to be able to use that money to buy food. Okay. I'm just trying to think in 2024, to give you an idea, it's about $188 per person. So how much they're receiving on a monthly basis. Federal government always paid for that. There are two changes in HR 1. The first is federal government and states shared the administrative costs of SNAP, and that used to be shared pretty much 50-50. What this is doing is saying, hey, states now have to share that. They have to pay 75% of that. So it's immediately putting this financial burden on states. Then there's a second piece to it, which is federal government used to pay for all the benefits. Now they're saying states are going to have to pay for benefits based on what's called a payment error rate. And sorry, I have to get into a little bit of explanation about what this is. What is a payment error rate? Okay. By the way, the Food Research FRAC, Food Research Action Council, or they have great resources on this. Okay, so the payment error rate is basically somebody has to decide if you're eligible for SNAP. They have to evaluate your eligibility and then they have to make payments. Sometimes they make mistakes. Everyone's human, mistakes are made. Sometimes people are overpaid, sometimes people are underpaid, right? And then there's this rigorous process, like 50,000 cases are evaluated, randomly evaluated at the state level. USDA comes in and audits about half of those, and they figure out the state's payment error rate. If your payment error rate is over 6%, if it's between 6 and 8%, suddenly your state has to now pay 5% of the SNAP benefits. And if you're 8 to 10%, okay, your state has to pay 10%. And if you're over 10%, your state has to pay 15%. So a state like California, which is sitting at about a 15% error rate, is going to have to pony up about $2 billion to pay for SNAP. Now, their state budget is something like 321 billion, just to put numbers in context, but it's a huge deal because they have to come up with that money. And so people are concerned, are states going to shutter their SNAP program? Are they going to make it very hard to enroll in SNAP? Is this going to really reduce the number of people that are getting this really incredible government safety net program? So that's my very quick one-on-one on that.
Right. And so just to put a finer point on it, one of the ways in which states can reduce their error rate is just to make it harder to get onto SNAP.
Yeah, right. So, and also, well, keep in mind, like they're also, now that they have to pay more of these administrative costs, they might have less staff to do this, right? And so they might just need to manage their caseload better, reduce the number, make it simpler for themselves.
Right. And so SNAP is getting more expensive for states, potentially less accessible as well, and harder to administrate because of the costs and the burden of it.
Yes, correct.
Okay, and so that's like a good picture of like the backdrop against which RFK Jr. is trying to promote food, better nutrition and food policy, simultaneously, giving with one hand, taking away with the other. I wanted to first, I don't know if Aviva or Lynn, if you guys want to jump in, you just raise your hand or unmute yourself, or you're welcome to. Otherwise, I'm going to ask my next question, which is that the Trump administration at the same time has been encouraging states to apply for waivers for their SNAP programs that prohibit SNAP dollars from being spent on soda and candy. So more in line with RFK Jr.'s nutrition policy. But this would be a major change for SNAP policy, which heretofore has not had that kind of restriction on it. And so there are a lot of different views among experts in the nutrition and hunger fields about whether or not this is a good policy. I'd love to hear from each of you about your thoughts on this particular piece of it, particularly in the setting of the broader landscape that you all have so eloquently described. Lynn, do you want to start first?
Okay. Well, first, let me say that I think as a society, we should probably provide cash income support rather than targeted food subsidies and let people decide what to use them for. That's an alternative way to address poverty and food insecurity. But that's not what we've chosen to do as a society. In the Great Depression in the 1930s, Ford's food stamps were launched really to absorb excess farm production and help farmers and reduce hunger. And they only covered fresh foods. But gradually, they shifted from support to farmers and low-income consumers to a subsidy for the purchase of mostly manufactured and highly processed foods made by Big Food, which everyone else is also eating. By 2008, I think only about 16% of SNAP dollars went to farmers, and about 4 billion a year was going to sugary drinks by about a decade ago. So should the government use our tax dollars to subsidize these unhealthy foods? That's the question, and what is the purpose of our investments? Is that the best approach for an anti-hunger or nutrition program? Is SNAP really an anti-hunger program? The WIC program, for example, operated for a long time, women, infants, and children, increasingly focusing on healthy foods and had a positive impact on child health. But SNAP dollars didn't really follow that route, even though they were very important in reducing child poverty and inequality. So as the obesity epidemic got worse, we started seeing proposals that SNAP dollars shouldn't be allowed for these unhealthy foods, first and foremost sugary drinks, and then that expanded to candy and some junk foods. I supported those proposals to not allow SNAP dollars and to tax sugary drinks for all consumers. Right now, the federal government spends far more subsidizing Pepsi and Coke through SNAP dollars than we do in the whole National Public Health and Prevention Fund. That doesn't make sense. But nevertheless, anti-hunger advocates in particular and other social justice advocates view SNAP primarily as an income supplement and are passionately opposed to proposals to restrict SNAP in any way, while they generally support incentives for fruits and vegetables, for example, which I also strongly support. But they feel that it's paternalistic and unjustified interference into choice of low-income beneficiaries, while the rest of us can spend our food dollars however we want. And these concerns are understandable. These are tough calls. And those concerns really blocked early proposals for waivers to reject paying for these foods. Now, under the new administration, they issued 12 SNAP waivers, all in red states: Arkansas, Colorado, Florida, Idaho, Indiana, Iowa, Louisiana, Nebraska, Oklahoma, Texas, and Utah and West Virginia. All of them restrict soda. 5 restrict energy drinks, 8 restrict candies. They don't incentivize healthy foods. 20 years later, I still think on balance, it's a good thing not to use our tax money to subsidize this stuff, and that we need other policies for the rest of the population. But as Christina noted, these new policies are accompanied not by reinforcing access to healthy foods, but by overall national cuts to SNAP, and to other needs for our most vulnerable. So the positive impact on nutrition may be masked by other harms. We really need to figure out how to use SNAP to incentivize healthy foods, disallow crap, and maintain and increase the overall value of SNAP to really be effective in combating diet-driven disease. Sorry, I probably went on too long.
No, you were great. Thank you for that. Aviva or Christina, what do you guys think? Aviva, do you want?
Go ahead, Abia.
Sure. I'll just say, I think this is a really tough issue and it's a really hard conversation because we don't have data on what happens when you restrict these foods and beverages from SNAP. And ideally, we would use evidence-based policy. We at CSPI, that's what we do. We look at what the science says and then we advocate for policies that have a strong evidence base for health. And here it's really tough because we're seeing all these waivers happen and we're going to see restrictions in SNAP. And we are really concerned that there are not going to be thorough studies evaluating what's happening on the ground to SNAP. A big concern that a lot of folks have is this going to increase stigma against SNAP participants? Are people going to drop off SNAP because now they don't feel good about going to the grocery store and using their money in this way? Is it going to affect purchasing at all? Like, is it going to affect health at all? And these are all questions that's why researchers exist to evaluate this. So we're really hopeful that these waivers are evaluated, and then based on that evidence, we can move forward with a more, just a better understanding. Because right now, I think it's a lot of like, this side is afraid of this, and this side is afraid of this, and it's just things that we don't have evidence for. So hopeful for more evidence.
So just to build on that, so I have like tremendous respect for the arguments on the other side. I personally am in favor of the government not subsidizing Coke and Pepsi. But I totally respect the reasons why you might disagree with that. But it is the case that 10 billion, Lynn, it's now $10 billion, $10.5 billion a year are going from our federal government essentially to Coke and Pepsi. Right? So actually, Aviva, and you will never hear me say this, or you have never heard me say this in any other context, I don't need evidence on this one because to me, it's more the principle of how the government spends money as opposed to, hey, did it make participants healthier or not? I actually think it probably won't. I think people would probably use other money to buy soda. I mean, maybe it will, maybe it won't. It's just not my driving belief on this one. Normally it is. Normally I just want, or making people healthier. I just feel like the government should not be subsidizing these companies and taking a stand in that way. Like, what I see this as an opportunity, and the moment we're in is, oh my God, our federal government has said soda is so bad and unhealthy, right? That we need to restrict it from SNAP. And what doors does that open for other policies, for that conversation? Now we have a precedent. Maybe we can do more with it. So that's the big reason I favor it.
Yeah. And I'll say I totally respect that. It's just differences of what we use to make decisions. Yeah.
And I agree with Aviva that we have to evaluate, but also with Christina that it's just plain wrong.
Yeah. And we're working on an evaluation. I'm very passionate about knowing the answer. Of course, I want to figure out what happens. It's just not my motivating reason to support it. Yeah.
Yeah. So I'm going to skip a little bit in what we're talking about because you all have, talking about this issue obviously raises the subsidies to Coke and Pepsi. And do we want to do that as a country, or do we want to actually like decrease consumption of Coke and Pepsi? And so another way in which we think about regulating, not or influencing intake of things like Coke and Pepsi is through taxes, and specifically sweetened beverage taxes. And so there are currently, I believe, 8 U.S. cities, Christina will correct me if I'm wrong, U.S. cities that have implemented sweetened beverage taxes in the past decade, including our own Philadelphia, or Christina and mine own Philadelphia. So maybe, Christina, I'll kick this to you because I know you've studied this. Can you tell us a little bit about these policies, these tax policies, and the evidence around their impact?
Yeah, absolutely. So, these taxes are all over the world at this point, right? Over 100 countries do them. We have our 8 cities. And look, taxes are just one of the most effective ways to change behavior. There's no question. You can't get more compelling data than what we've seen in tobacco. Now we've been studying it for sugar sweetened beverage taxes, and they work. We studied it in Philadelphia. The tax goes into effect. We looked at data from millions of transactions from chain retailers, supermarkets, mass merchandisers, pharmacies. As soon as the tax goes into effect, you get a 50% drop in the sales of these drinks. Now, we have it compared to Baltimore, which is our control city. And then you do get some people who leave the city to shop outside of it to avoid the tax. You have to net out that cross-border shopping. You still get a 35% decline in these sugary drink sales that's sustained. If you study nutrition and diet interventions, virtually nothing does that, right? Really, really powerful. And it's, Econ 101. I'm not teaching you anything new here. Okay, but here's what's really interesting. So now that it's been established that you get these large purchasing effects, and I should say, Philly has the largest sized effects. Other cities have seen 15% declines, for example. But once we established that, the question was, do they improve health? And my prior on this was, no. Like, that would be a hard thing to do. These are really complicated behaviors. We're just taxing one food category. Like, that'd be very surprising. And then, to my surprise, because now all this evidence is coming out using these natural experiments, they do. And I'm not, it's not giant effect sizes, but like we looked at dental cavity data. We see a 20% reduction in cavities not among the overall sample, among the Medicaid population. Other cities, we saw 1% decline in BMI in Philadelphia attributed to the tax. Other cities have seen bigger. We have ranges between 1 and 8%. The UK taxed their whole country. They're seeing reductions in hospitalizations for asthma. Like these data are now coming from all over the place, and we're starting to tell this story of wow, BMI reductions are being observed. Improvements in oral health are being observed. There's a paper using national data on gestational diabetes, and we're seeing reductions there. So much to my amazement, they seem to have a health impact. And I just have to say one more thing about them. If you want to fund your SNAP program, if you're a state that wants to fund SNAP, tax sugary drinks, you'll do it. It'll take care of it.
But there are no states right now that tax sweetened beverages.
States haven't done it, but I'll give you an example. Connecticut introduced because they wanted to fund universal school meals. Right? And the revenue, to give you a sense, Philly is generating about 73 million in revenue per year off of this, and they used it to expand access to high quality pre-K in low income neighborhoods, to rebuild infrastructure in the city. The tax allowed them to borrow money to then do job training programs and all this infrastructure program. So the revenue benefits are tremendous.
Right. So all these spillover effects that you haven't really described. Yeah.
Exactly.
Lynn, you looked like you wanted to weigh in.
Oh, I would first agree with everything Christina said. I think, and the lessons that are coming in from around the world are really just fabulous. The rest of the world's way ahead of us on this. One of the lessons is that the taxes should be big enough. So Philadelphia's tax was actually twice the size of the Bay Area taxes, and it's more effective and it raises more money. So taxes need to be big enough. Although even in San Francisco and Berkeley, which I studied, they were effective in reducing consumption, especially heavy consumption. But we saw bigger effects where bigger taxes were put in place. We need to capture that revenue and really put it towards either nutrition or other social needs. Some places are using it for childcare, and those things are all okay. So big enough, capturing the revenue are two key lessons. And we need to spread them to bigger jurisdictions like entire states. In California, we've been fighting for a state tax for years. The soda industry has fought back hard and fought back dirty. A few years ago in California, they that would have kept every state from every local jurisdiction in the state from being able to raise revenue. They would raise the threshold for any local tax, and they just use that as a bargaining chip to get the governor and the legislature to back off on doing a soda tax. So there's a lot of money, a lot of lobbying, a lot of back alley brawling going on to keep soda taxes from passing in our states, but they're still a good idea and a solid policy.
Yeah, I'll just add that in the current funding climate, as Christina mentioned, as states are really strapped for money, we are hoping that more states and localities are going to look towards taxes on sweetened beverages to raise money to support SNAP and school meals and all these things that we know need a lot of money and just don't have money right now.
Yeah.
Yeah, and I'm sorry, Rachel, I'm glad you can also tax Skittles. Like we could go a little further and generate more money.
Yeah, Mexico did that. Hungary did that. These are good ideas. This is the right thing to tax.
All right. So I want to talk about a few more policies or levers that states, municipalities, countries can use to affect nutrition policy. And one of those is use of nutrition guidelines and regulation, sort of supporting those guidelines. And so, Aviva, I'm going to ask you, starting with the Dietary Guidelines for America, which has come up already. Those are created by the Department of Health and Human Services, or released at least, as I understand it. Maybe you could tell us a little bit more about what they are, how they're developed, and why they're important.
Yeah, so the Dietary Guidelines for Americans, or DGAs, I use a lot of acronyms, I'm sorry. They're a set of guidelines that are published by USDA and the Department of Health and Human Services every 5 years. And their goal is to provide evidence-based advice on what we should be eating and drinking in the US to maintain a healthy diet and prevent chronic disease. One of the reasons that the DGAs are so important is because they're used to guide the nutrition standards used in our country's nutrition assistance programs, like the National School Lunch Program, the School Breakfast Program, and WIC. So the dietary guidelines, even though it sounds kind of like it's just an educational tool, they actually affect the diets of tens of millions of Americans who rely on these programs every day. The DGAs are also important because they're essentially the cornerstone of federal food policy in the US. So once the DGAs say something like we need to limit sodium in our diet, that can spur executive agencies like the FDA, as well as Congress, to start passing policies and regulations to help us adhere to those recommendations. Now, in terms of how these are developed, the guidelines are updated every 5 years. The updating process starts with HHS and USDA publishing scientific questions to guide what the next DGAs should examine. And then these questions are open for public comment. So the public, the food industry, everyone can comment on what these questions should be. Then a Dietary Guidelines Advisory Committee, or DGAC, is appointed. And this is a group of nutrition experts who are typically from academia. So they are not affiliated with government, they're an outside body, and they are tasked with leading these big systematic reviews of the scientific literature to answer the nutrition questions that were posed by USDA and HHS. The DGAC eventually publishes a scientific report that is very long, very dense, very scientific, that summarizes its findings and then proposes guidance on what should be in the upcoming dietary guidelines. Then USDA and HHS use that scientific report to write the dietary guidelines for Americans. And they also, in addition to using the scientific report, they consider public input, input from the food industry, input from policymakers. So at the end of the day, the DGAs are influenced by science. They're actually required to reflect the preponderance of scientific evidence, but they're also the product of politics. So what we're seeing right now is that RFK Jr. has hinted, RFK Jr. is the head of HHS, he's hinted that the DGAs are going to emphasize the importance of meat and dairy and saturated fat, which is a departure from the DGAC report that came out earlier this year. And it's also possible that there have been hints that they might eliminate quantitative limits on saturated fat and sodium, which could upend a lot of nutrition programs in this country. But it's really not clear. Again, hard to figure out how much of what is said is actually going to be translated into policy. RFK Jr. has said that the DGAs are going to come out this month, but with the government shutdown, unclear what's really going to happen, although we've heard that they are continuing work on the DGAs through the shutdown. But the guidelines are required to come out by December. So we're going to see what the US recommends very soon. Yeah.
Okay. And one of the reasons, as I understand it, that the guidelines are important is that they influence food labels. And so I want to just shift a little bit to food labels and regulatory activities that have been focused on food labeling. So I believe that the Biden administration finalized a rule governing the labeling of food products as healthy, and proposed voluntary front of package food labeling. And the idea is that these proposals equip consumers to make better informed decisions about food products. I'm wondering if one of you could let us know sort of what the status of that rule is, and then I'd be interested in having a little bit of discussion about the evidence around the effectiveness of food labeling. So the status of the rule, the Biden rule.
Yeah, I'm happy to share the status. So this is a rule that's proposing a mandatory front of package nutrition label on all foods and beverages in the US. So this would require a label right on the front of the package that tells you if the product is high in or medium or low in added sugar, sodium, or saturated fat. And that was a proposed rule. There was a lot of public comment that was due earlier this year. And now the FDA is kind of back to the drawing board, reading all of the comments, responding to all of the comments. And they have said that they are going to publish a final rule. So this regulation would be finalized by May 2026. So we are currently waiting.
And front of package food labeling, a good idea? Evidence?
Yes. Yes, very good idea. Again, US is very late to the game. Like 17 other countries have mandated front of package labeling already. I think we have very strong evidence that this is an effective policy to help consumers choose healthier foods. And it also spurs the food industry to reformulate their unhealthy foods to be healthier. So the consumers just have more healthy options to choose from and fewer unhealthy options to choose from. So I think it's really important. I think the design is important, and depending on how it's designed, there could be very different effects. But we are hopeful that FDA's policy will be strong, and will result in the changes we've seen in a lot of countries, like in Latin America and across the world.
Yeah.
Well, okay, I'll say a weird sentence. I've studied food labeling for almost 20 years, which is like kind of crazy to think about. But I have. And so I don't want to repeat what Aviva said because she's exactly right. Yeah, food labeling does work. It's not that it produces giant effects, but it does shift consumer behavior. But the point I want to add that people I think underappreciate about food labeling, like, yes, it's right to know. It brings transparency to the food supply, which we almost never do. So that's a great thing. But then it does this other thing, which is makes it easier to implement other policies, right? So if we label our food supply and then we want to tell schools, hey, you've got to serve, minimally processed foods or foods that meet some sort of nutrition standard, it's just much easier for a food service provider who's procuring that food for schools to be like, okay, I can't get the ones that have all the stop signs on them. Like it just makes implementation of other policies also much easier. And I do think, and I have no evidence for this, but I do think it can serve a role in changing norms. Because if we did actually label our food supply and you walked into the supermarket, you would be like, oh my God, wow, our food just has way more saturated fat, added sugar, sodium than I thought. And so might that then spur other kinds of policies would be also the hope. And I'll say just one more thing, a downside of food labeling. Yes, it can spur reformulation. Hopefully the industry wants to lower sodium in food if it gets labeled. But what we're seeing in Latin America, for example, is that added sugar is being reduced, but then things like non-nutritive sweeteners, sucralose, these other additives are getting pumped into the food supply to replace that. And so you want to think a little bit like maybe that needs to be on the label as well, for example.
Yeah, I'd say, we've had these fantastic experiences started in Chile, actually, with Chile putting stop signs on highly processed foods, high in saturated fat, sugar, and sodium. And now kids know what a junk food is. They don't know it because of numbers or milligrams. They know it because there's these big black boxes on crappy foods and chips. So it's got to be really visual. It's got to be really easy to interpret. The food industry wants it to be complicated numbers that people have a hard time processing, or red green lights, so that if there's a red light for sodium, there'll be a green light for sugar, or vice versa. That leaves people confused. So it needs to be really simple, really easy to interpret, and something that steers people away from these highly processed and unhealthy foods. And just remember that fresh foods don't have these labels. They don't need these labels. Apples aren't going to have them. Chicken isn't going to have them. Kale isn't going to have them. So just the complete absence of these labels on the foods that we do want people to eat is super important.
Mhm.
Can I just pull out one thing Lynn said that is hard to emphasize without a visual, but really needs repeating here? The current proposal is very confusing that FDA has put out because imagine lines of added sugar, sodium, saturated fat, and then next to them there are words high, medium, or low. And so what Lynn is saying is like some of them are going to have high next to added sugar, but then low next to sodium, right? And so it's like pulling up to a traffic light that is red and green at the same time. You don't know what to do. And so to Aviva's point, the design really matters. And so what a lot of advocates and scientists are trying to work with FDA on now is to do something simpler, right? And they have a proposal to just put high in sodium, saturated fat, added sugars and get away from this complicated, multi-messaging.
Yeah. Just focus on what's too high.
Yeah.
Yeah. And that is what like everyone else in the Americas does virtually. Like everyone just focuses on high end. And it works.
Okay. One of the things I heard Christina say was that one of the important parts about food labeling is that it leads the ability to regulate food and to change our sort of standards around food. And so, Lynn, I want to ask you about trans fats. So you worked in New York City under Mayor Bloomberg when the city launched the nation's first trans fats ban. What lessons have we learned over the course of time to inform future policy changes about how to make a national change around things like banning trans fats, which we have not done nationally yet?
Okay, before I jump into trans fats, I just say one thing. In those countries that implemented these labels, they tied it to marketing to children. They tied it to school food. So something that had those labels, you couldn't sell in high school. Um, and you couldn't market it on TV, for example. Um, so that really increases the effectiveness too. But getting to trans fats, there's a lot of lessons from trans fats. First, they illustrate what Aviva started this conversation with, which is what happens when we allow new processed chemical cocktails to replace real foods on a massive scale and without rigorous or any evaluation at all. We have incredibly complex and demanding requirements for a new medication that comes onto the market and that maybe a few tens of thousands of people will use once in a while. But we allowed novel chemical substances to be added to our food supply that hundreds of millions of people will eat every day. I grew up eating margarine, which is trans fats, um, based on a nod and a wink to food companies called generally recognized as safe, which they're allowed to self-declare essentially. And that's really dangerous. Trans fats came onto the market 100 years ago, replacing, many natural fats and oils. It took over 70 years before we had data showing that it was causing heart disease. Um, and it took another 2 decades to get it out of the US food supply and for the FDA to recognize that it wasn't safe. It's still in use internationally, although increasingly it's being taken off the market. But it really gives us the lesson about grass and about the need to evaluate what we're putting into our food supply. And I think that's a positive thing in the MAHA report. But the trans fat story really also gives us very practical lessons about policy spread. So in 2003, Denmark banned trans fats. In 2004, teeny little Tiburon in California did a voluntary ban in its restaurants. In 2007, in New York City, we were the first place to prohibit its use, and we could only do it for restaurants because that's what our authority was. But if Tiburon was a ripple and then New York City generated a wave, and then we saw a tsunami of cities and counties and states banning it. And by 2018, the United States had banned trans fats, and a lot of other places had followed or some were ahead of us. So, we've seen this with smoke-free air, we've seen this with other policies. So just, I think the importance of local innovation, of communities coming together to implement policies and programs to transform the food supply, that's making a real difference. Um, Food is medicine started locally and is spreading, and it's in the MAHA strategies too. So we're trying to change a food supply with immense deep-pocketed vested interests, and it's going to take that persistence and dedication and creativity and funding and local initiatives to make progress. It's really great that Kennedy's talking about healthy food in a way that hasn't been discussed before. But when big food heads to Mar-a-Lago and pulls out their checkbooks, what's actually going to happen? Um, we need that local bulwark to hold fast and make progress too.
Yeah. And it just, you clearly stated that trans fats have been banned in the US in 2018. When I said they hadn't been banned, I was not not talking about trans fats. So they have been banned since 2018. Um,
I'm sorry, what hasn't?
Trans fats have been banned. I
Yeah.
accidentally misspoke.
Oh, yes.
Christina or Aviva?
I just want to chime in. I mean, you can't understate how important this policy has been and like the tremendous work Lynn did to save lives from this policy. So the evaluation, we now have evaluation data from Denmark, and you see clear reductions in cardiovascular disease. Like this is such an effective policy. And so it's just been amazing that, like, thanks, Lynn, for helping to make it happen. Like lives have been saved.
And we had to, and we did that. We knew it was a problem, but it was really hard to estimate what the health impact would be. We did it, kind of back of the envelope and took it to the mayor, and he was brave enough to move forward with it. And then the valuations in New York State as well were very close to what we estimated in terms of reductions in cardiovascular deaths and hospitalizations.
Yeah.
Yeah. I'll just add it was a monumental public health victory to ban trans fats in the US, and it took many decades. And I think that kind of speaks to the slow pace of policy progress. And what we're seeing now is a lot of excitement. And I think, especially at the state level, we're actually seeing policy moving forward. And so that's where I think, like trans fat, really looking to the states, like what are the states doing? How are they going to push this forward? And I think it'll trickle up to
Yeah.
nationally. The other thing I just wanted to mention, trans fats, one of the things that really helped us ban them was labeling. They were added to food labels, and then that
Yeah.
helped make the case for like, wow, there's so much trans fat in this food. We need to get this out of our food supply.
And
Well,
organizations like CSPI, which raised the issue, which petitioned, which fought for decades.
and
And
so I want to briefly touch on one last. Oh, Christina, were you going to say something?
oh, I just wanted to, because Aviva said something really interesting. I mean, all this excitement around food, your point about it takes forever. The thing that I find fascinating, I'm very curious, and I don't have an answer, um, is this change in conversation gonna reap benefits? Maybe not right now where there's a lot of chaos, but 5 years, 10 years, like does it shift us so fundamentally in how we think about food, how we think about the food industry, what states are doing, that longer term it actually sets us on a better path, even in the midst of some hopefully shorter term destruction? I wonder that.
Yeah. And the question I was actually going to ask is sort of related, which is that one of the pieces that is missing from the MAHA Children's Strategy is sodium reduction, which has been mentioned, but potentially has enormous health impacts and could be addressed on a national scale. And so I don't know if any of you want to weigh in on the importance of sodium reduction or what it would take to actually have some movement in this area.
Vivi, you have to kick this off because you've done such good work in it.
Yeah, I mean, sodium isn't a very exciting topic, but it matters so much. And I've spent a lot of time like doing research and writing about sodium. And I think it's really notable that the head of the FDA during Trump's first term, Scott Gottlieb, he said publicly that sodium reduction was the number one most effective public health action related to nutrition that we could take. And I agree. I think in the US, nearly everyone consumes more sodium than is recommended. It causes high blood pressure. It increases our risk of cardiovascular disease, which is our number one killer in the US. And it could just save countless lives and billions of dollars every year if we could just get our sodium reduction down. But reducing sodium is really hard because education isn't going to work because the majority of sodium in the US diet comes from packaged foods and restaurant foods. So it's not up to consumers. It's really hard as a consumer to limit your sodium if you are not cooking all of your food by yourself. And that's why we need regulations. We need the FDA to step in and say, industry, you need to just blanket reduce the sodium. It evens the playing field for everyone. They don't have to worry about that company competing with them because they kept their sodium levels high. And over time, our taste buds do adjust. We don't like our perceptions of saltiness can adjust over time. So I'm hopeful. FDA has sodium reduction targets right now. It's a guidance, so it's voluntary, it's not mandatory. They just had their first round of sodium reduction targets for industry where they said to industry, all of you, packaged foods, restaurants, you need to reduce the amount of sodium, and here is the exact level that you need to bring it down to. They're currently evaluating the first set of targets. They have a second set of targets that are more stringent, trying to bring it lower. And those are hopefully going to be finalized, I hope, in the future. But I think that kind of work, that blanket regulation, is where it can really, really help with sodium.
So you get 30 seconds, Christina. You wanted to say something?
Well, we know it can be done because over 40 countries do it, and the data are clear that it reduces population level blood pressure, right? So companies are doing this in other countries, and it's possible.
Yeah. Well, this may lead to your answer to the next question, but we only have about 5 minutes left, and I want to wrap up. And I want to wrap up by asking each of you if we've talked about a lot of different approaches to food policy and to improving the health of Americans through food policy. If you could make one change, or you could recommend Secretary Kennedy one change, what food policy do you think would do the most towards meeting the goal of making America healthy? Who wants to go first?
Look, as much as I love taxes and sodium reduction, and they feel like low-hanging fruit, the way I would answer this is I would fundamentally change the school lunch program, right? Because that's touching majority of kids in the country. I would really focus on getting minimally processed, healthy, nutritious, good tasting food, the infrastructure and money to do it, and really reduce the exposure to ultra processed junk foods that is coming through our schools. And that will help shape healthier habits too for a generation. So that is where I would invest.
I'd say, much as I love talking about sodium and sugar and things, I think the overarching strategy has to be a global commitment to push our food supply to fresh and minimally processed foods, really using every lever we have, subsidies, taxes, procurement, education, labeling, drop stop Pop-Tarts and eat strawberries. But really, let's take our very powerful government and private forces to promote and make economically viable, beautiful, delicious, healthy, fresh foods that people want to eat in ways that they can afford it. This is an easier message than telling people how many milligrams of sodium to eat, but it works and it's more comprehensive and better. We love to go to Italy and France and eat their wonderful food and say how beautiful it is. We can build our American version of delicious fresh food from, August peaches to beef tomatoes and grilled chicken here in the United States by just fundamentally re envisioning where we want our food marketplace to go and making it happen. That's not one small policy. I cheated.
I'll just say that was beautiful. And I love that you painted a vision, a positive vision for the future. It's very inspiring.
I stole that from Carlos Monteiro in Brazil. He actually deserves credit for this
That's
vision.
great. No, I think it's so important to not only I do a lot of criticizing of what's currently happening, but it's so important to show this positive vision and how we're going to get there. I will say I think that no one policy can do all the things, and CSPI has a federal policy menu that you can check out on our website with all of the things that we need to do. But I'll just add, I agree with everything that's been said. I'll add, I think that in terms of low-hanging fruit that we could jump on right now, fiscal policies. If you change the price of a food, we know that people, like if you increase the cost, people are going to buy less of it. If you decrease the cost, they'll buy more. We should make healthy food so much more affordable and unhealthy food so much less affordable. So those are kind of, I say easy, it's not that easy, but it's easier than systemic change.
All right. Well, thank you all so much for participating in today's conversation. It was really a wonderful conversation. It's a complicated topic, and there's a lot going on, and you've done a great job of helping to make it clear and see the possibilities for a better future. So thank you so much for participating today, and thanks to audience for joining us. We have another event coming up soon. So save the date. Our next event is value-based payment, time to replace it or reform it. Slightly different topic, but equally important. And that will be on November 7th, also by Zoom. So visit us at our website for more information. Thank you all so much for joining us, and we'll see you next time.